here. I think we have every board member here today. First, we will stand for the Pledge of Allegiance to the flag. I pledge allegiance to the flag
of the United States,
and to the republic for which
which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. You may be seated. We will first take care of an introduction. I would like to introduce to you, new to our board, new to the county commission in Shoshone County, we have Tracy Cassidy. Welcome. And we look forward to seeing you here at our meetings every other month or whenever we meet. Thank you. Okay. And also, I'm going to put Dawn on the spot. It's okay. Michelle was going to be here today, which would have probably been Michelle's last meeting with this board. And I'd like to turn it over to Dawn to give you a few words to bring us up to date with Michelle Kenny at this point.
Well, thank you, Mr. Chairman. So for those of you that may not know, Michelle Kenny has been she's been with us for a very long time. She's been with the health district for, I believe, over 20 years. And for the past several years has served as we call it an HR specialist, but really our HR director. And she has made the decision to retire. And her last day will be September 30th. So we will miss her terribly. All of our employees will miss Michelle terribly. The positive impact she's had on the health district is frankly very difficult to measure. And that's a hole that will be difficult to fill. And we're in the process right now of interviewing for that position.
Michelle came to work at the health district 1 month before I was elected to this board. So I can tell you that she has been with us a little over 20 years. That doesn't mean now that Michelle and I are the same age. But I will tell you that Michelle's mother and I are within a few days of being the same age. Okay. We will open up the meeting right now for public comment. If there is any public comment from anyone, this is your time for up to 3 minutes for that. Is there anyone here who has come for that purpose? Second call. And third call for anyone with public comment. This is your opportunity. Hearing no one, we will declare the public comment session closed. And we will move on with our consent agenda. Is the item number 4 on your agenda. So there's the minutes of July 28 and the division reports. By the way, can I just stop long enough to tell you division directors how much I appreciate those division reports. Those are very, very important to all of us. I wish we had time to hear more comments regarding information and maybe even more that's in the consent agenda and the division reports. But I'm just amazed at what all the things our people do. And this is only the tip of the iceberg, really, when we read the division reports of what our people are doing here and there and around about the 5 northern counties. And I really appreciate these division reports. Then there are the contracts. You see the contracts. Now, if you have any questions or want to discuss any of these contracts, this is your opportunity to pull the contract from the action to accept these contracts. Are there any contracts now that you would wish to pull for further question or discussion? Anything you would like to talk more about? Okay. Item D is the repeal policy. And Mr. Director, could you give us 2 or 3 sentences about this repeal contract?
Well, Mr. Chairman, it's impossible for me to keep this into 2 to 3 sentences, but I'll keep it closer to maybe a half a page if I may.
Thank you. We will go on without him this.
So it's been over a year ago that the federal government sent out a statute in which that most healthcare organizations that received Medicare funding, that there was a requirement that employees associated with that entity must be vaccinated. That went all the way to the Supreme Court, which also supported that measure. At the time, we had home health services, and we were billing, of course, the vast majority of the billings we did were for Medicare patients. So we fell under that umbrella of needing to have a vaccine, COVID-19 vaccine mandate for all of our employees. Now, there was also an opportunity for, and not just if you work for home health, but in talking to our attorney, because we all bill under the same tax ID number, or we serve under the same tax ID number, this cast a net to all PhD employees were required to either be vaccinated or provide a medical or a religious exemption. As you know, at least the board members are aware, we have elected to end our home health program, and I'm going to be talking about that later on this agenda. And so with home health no longer being under the umbrella of Panhandle Health District, that mandate requirement no longer exists. So it is, what we're recommending is that we repeal this COVID-19 vaccination policy for anyone working at Panhandle Health District.
Thank you. Okay, any questions you have for his comment on this? And if not, I will call for a motion to approve the consent agenda, which includes item A, B, C, and D. Is there a motion? Yes. Dr. McClanders?
Intercede, just a question to clarify.
Sure.
So the services that our nurse practitioners provide do no billing to Medicare?
Mr. Chairman, that's an excellent question. So in our clinical office, we still bill occasionally Medicare patients, particularly Medicare patients that may come in for flu shots, for example. It was clearly in the statute that medical offices, it did not apply to them. So any doctor's office, this mandate did not apply, but it did do organizations like hospitals and home health agencies. They were very specific, and they were very specific about carving out that group of individuals.
Thanks.
All right. Yes.
Mr. Chairman, just a comment and a question. I fully support this action of repealing this. The COVID situation has been changing nationwide, statewide, and obviously at the local level here. And my opinion is that a lot of actions that have been taken regarding COVID are changing based on more evidence and lack of information from the Centers of Disease Control as to the deaths, the numbers affected, et cetera, et cetera. It has not been tracked nearly as well as I think it should, because if it had been, we would have better data and information on who it's been impacting, and especially the vaccines for younger people. Athletes have been dying with heart murmurs and different things, and I think that's pointing towards some of these vaccines. And so I condone this action. I support it. That was my comment. And I'm not sure what information, Don, you and your staff have used to, make this determination and take this action, but I appreciate it.
Okay. Are you wondering that someday,
Is there any specific data that you used that influenced this action of repealing the vaccination policy?
Mr. Chairman,
yes,
from a health district standpoint and from our epidemiology folks, we are still supportive of the COVID-19 vaccine, including the new bivalent that now is available. That being said, we also believe in the adage of we teach people correct principles and let them govern themselves. We will continue to provide information about the need to become vaccinated, but it is up to the individual to make that choice. Consequently, we aren't comfortable with the mandate, and then it starts bringing other areas in HR. Do we begin to mandate flu vaccines and other immunizations out there? And I have to add, in this world of difficulty in hiring individuals, that becomes a challenge. Now, again, we will still encourage those vaccines. So that's the basis of our decision.
Thank you.
okay, yes, Dr. Fletcher.
Yes, Mr. Chairman. So Panhandle Health is still supporting vaccinations all the way down to 6 months?
Yes, sir.
And you've predicated that decision on what?
Mr. Chairman, it would be best to have our epidemiologist come and show you the information that they have shown me of why they're suggesting to continue to be vaccinated. And I might suggest that that could be a program update at a later time. But they are basing that, Dr. Fletcher, on the best medical information that they can gather.
Mr. Chairman?
Yes, go ahead.
Were it the case that the epidemiologists were going to come and make a presentation, is it permissible that a board member could make a presentation also?
Yes, if you wish, if you go through the process of requesting to be on the agenda, absolutely.
How does one go about doing that?
You tell this lady right there.
Can I tell her right now?
You can tell her right now.
Okay, put me on both.
Okay.
I'll
Now,
get you a PowerPoint presentation and all.
what I'm hearing, and hear me out here, do you have, it would be well within our parameters to pull item D from the consent agenda if you wish to put that on the agenda with other comments at our next meeting.
Oh, that's not my intention at all. If you're
Okay.
looking to repeal this doggone thing,
Yes.
I would say urgency is of high
Okay.
importance.
Okay, just so we,
So I certainly don't want to
okay.
countermand the repeal.
All right, just so you understand that we can go one way or the other with any item on this consent
And I
agenda.
appreciate that, sir. Thank you.
All right, then we're still Unless there's any other further comment, Dr. McClanders, Sir
Is there a
John?
motion to,
We don't have the motion yet.
I'd go ahead and make a motion that we approve the consent agenda as presented.
All right,
Second.
we have a motion and a second. Any other discussion then regarding this motion? Which if we approve this motion, then we have approved the entire A, B, C, and D of the consent agenda. So we're all clear on that. Are we ready to vote? All right, all in favor of approving the consent agenda as listed here in the agenda, indicate by saying aye.
Aye.
Okay. We hear you, Tim, loud and clear too. Thank you. Okay, we will move on then. And we're glad to have Eric and Mary here today. We're going to start out with Eric, if I may, and he will make an introduction, but also he has some beginning comments. Eric, you have the floor.
Thank you, Mr. Chairman and members of the board. In a moment, I'm going to introduce Mary Reinberg, who's our program manager for the Institutional Controls Program, which is based and primarily operated out of our Shoshone County office. One thing that I'm going to mention is I've never found Institutional Controls Program a terribly intuitive title for a program. So for my benefit primarily, but also to share with you, I've learned that it's a federal term for a non-engineered solution. Largely, it's going to be a legal or administrative solution, which is exactly what this is. It's a set of rules that minimizes the public's exposure to contaminants in a Superfund site. So I'm going to, I guess I'll share with you that my knowledge of the Institutional Controls Program continues to evolve. My background is much more with the Environmental Health Program, but I'm going to provide a very abbreviated summary of that program, which helps provide context to both Mary's presentation as well as the letter of support that I will be presenting on here shortly after Mary's presentation. The Health District has been involved in contamination associated with historic mining in Silver Valley. Mining began in 1883. The Health District's involvement came about in the early 70s. Around 1974, 75, there was elevated blood lead levels in children, highest in the nation. The EPA, the Idaho Department of Health and Welfare, and the Health District all became involved in working to abate that issue. At the time, or in the late 60s, mines were dumping around 2,200 tons of mine tailings per day into water bodies throughout the Silver Valley. In addition, there was a smelter located in the aptly named Smelterville that was also significantly contributing to air pollution and the spread of contaminants throughout the valley. In 1983, the EPA added the area to the national priorities list, which made it eligible for Superfund funding. And at that time, efforts did begin in regards to soil cleanup and certain mitigation type efforts. In 1995, the ICP rule was established and held by the Panhandle Health District, which encompassed the 21 acre, 21 mile? Thank you. 21 square mile area around the smelter, which is where the contamination was largely concentrated. In 2007, that rule was expanded to include the basin, which includes roughly the area from above Mullen all the way to Harrison. So it encompasses large portions of both Shoshone County and into areas of Kootenai County. So that's sort of the abbreviated version that I have. I did speak with Mary, and she did provide some facts to the extent of this program and the impacts that it has in the valley. And again, this is a collaborative effort with the Health District, DEQ, as well as the Environmental Protection Agency. In calendar year 2021, the Health District issued 1,318 permits. They licensed 576 individuals and 331 companies to appropriately manage and move contaminated soils and replace them with clean soils. free disposal of over 3,000 cubic yards of contaminated soils, and there were 852 property disclosures allowed. I bear with me, I jumped past a portion of my project to put some context to those numbers. There are three major components of the program. One is of the ICP program. One of those is the permit aspect of it comes from construction activities that may impact the barrier, the soil barrier, which is a 6 to 12 inch barrier that's overlaying the contaminated soils that permeate the valley. So Mary and her crew, they work very hard to make sure that those barriers are in place so that children and the general public are not exposed to the contaminated materials. They also spend a significant amount of time doing outreach and education. They do have a licensing training program for contractors. They do sample assistance as well as removal of contaminated soils. Another key element is that they house all records of remediated sites. Why this is so critical is without those property disclosures, real estate transactions would not be able to occur in the Silver Valley at all. So that allows real estate transactions to occur, which obviously would be a significant economic burden if you couldn't sell your property. I'm going to go a step further than that because this helps also provide some context for what I will be for the letter of support that I will be presenting on. As noted, the Health District held those rules since 1995. In the legislative session of 2019, all IDAP rules were allowed to expire. We spent the following 3 years working very hard to try to get those rules reauthorized. However, last December, largely because of House Bill 316, we were removed from the omnibus rulemaking process, which essentially eliminated our opportunity to present to the committees and have an opportunity to reauthorize those rules. So we are currently making efforts to work with DEQ and work with local cities and counties to get those same protective measures put into place at a local level. So with that, you may have some questions. I'm going to ask Mary Reinberg to come up and with Mr. Chairman's approval.
Thank you. Sure, any questions you have for Eric before he turns the floor over to Mary? Yes, Glenn?
Eric, I was curious, where has the contaminated soil been disposed of?
Mr. Chairman, if I believe I know the answer, but I believe Mary will be able to provide you a much more thorough response.
Sure.
Okay. You have the
Okay.
the floor. Thank you, Mary, for being here. I've been looking forward to having you here and make your presentation to the board.
Thank you, Mr. Chairman. Appreciate that. To answer your question, we have designated repositories that are distributed throughout the site where all contaminated soils are hauled to and maintained into perpetuity.
Okay. So it's fairly close. It's within Shoshone County.
Yes, correct. We've got several established to make it convenient and keep it local for the convenience of our contractors and homeowners to be able to dispose of and get rid of that material easily.
Yeah. And the cost of transporting it elsewhere.
Yes.
Okay, thank you.
You're welcome. All right, we ready for the presentation?
How savvy are you with sharing the PowerPoint and Zoom?
I'm okay, usually.
Okay, it's already open. You can just share it.
So you might have to show me.
Just,
Oh, there it is. Share screen?
Yeah.
Okay.
And select the PowerPoint.
And then
Begin the slideshow
from beginning.
and then you can use this to advance the slides or go back.
Beautiful, thank you. Okay. So as Eric introduced, my name is Mary Renberg. I'm the program manager for the Lead Health Intervention Program and the Institutional Controls Program with Panhandle Health. And what I'm going to discuss with you guys today is kind of a summary of our annual lead screening program that we just concluded in August of this year and give you kind of an update as to how that went. So we will talk about the lead health intervention program background and the approaches and procedures that we use specific to this year, and then our preliminary results. So our lead health intervention program is a public health service. It is not a study or an experiment. We have been holding it in the Box region since 1974. The actual creation of the lead health intervention program was established in 1985. The efforts from 74 to 85 were in conjunction with the Idaho Department of Health and Welfare and the CDC. And then we kind of went off on our own in 85. We've also been doing the screening out in the Basin region since 1996. So the at-risk populations that we're trying to capture include primarily children, and the most susceptible group is 6 months to 6 years of age, because those are the ones that are still growing, developing. They're down on the ground, they're doing the hand-to-mouth contact, their behaviors make them more susceptible. Pregnant women, also recreational activities, and then industrial, because we do still have active mining in the Silver Valley. That is still a source of exposure. And to kind of give you guys a history as to where the program has brought us, this is a chart showing the blood lead averages from the Box region, because those go all the way back to 1974 up until 2019. We didn't include 2020s or 21 because of COVID. That highly affected our numbers. But you can see we broke the levels down by community. So Smelterville was the closest to the lead smelter, and then the Kellogg-Wardner area, and then Pinehurst. And starting in 1974, we had an average blood lead in children of 67.4. At that time, the CDC health standard was they wanted children to be less than 40. So as time progressed, you can see our numbers start to drop significantly. And you can see the US average is down there on the bottom. And so we're right on trend coming down with all of the rest of the country. Still a little bit above, but we still have a lot of contamination in place. So that's to be expected. A lot of progress though. So the lead health intervention program participants would be for anybody that lives, recreates, or works within the Superfund boundary. And so this is our administrative area here, just a visual. And you've got the box that is literally the box there in the center. And then the rest of the areas outlined are known as the basin. This year, we had a $50 cash incentive for the participants that fall within that 6 month to 6 year age group. So the way we go about it is we do an informed consent with the parent or a legal guardian, and then we go through a questionnaire. We do the screening by a blood test capillary finger stick, and then any finger stick that is over a 3.5 microgram per deciliter of lead in the blood are followed up with a venous confirmation test. The 3.5 number is the CDC's established threshold for what they want all American children to be at or under for lead exposure. We then offer consultations and follow-ups with all children that do sample over that 3.5, at the 3.5 or over. And previous years, we have used a lead care analyzer machine that would give us a detection limit of a 1.5 microgram per deciliter. Unfortunately, before last year's screening, there was a massive nationwide recall on the test kits for that. So we secured a substitute analyzer with our distributor at Magellan, and we used the Lead Care 2 machines that did have test kits that were fully operational. That, unfortunately, that machine only has a detection limit of a 3.3. So that does kind of alter our results and what we see, but it's such an important service that we wanted to make sure we still offered it no matter what. So the replacement kits were still not available for this year's screening event. So we again secured the Lead Care 2 machines and proceeded as we did in the 2021 screening. We screened a total of 351 individuals this year. 216 of those were in that children's age group of the 6 months to 6 years. So those were the ones that were eligible. And so we had a very good turnout. It was a very successful one. I do not have the averages calculated for you guys yet. That's a very lengthy process to get all that data entry. And so I will have that as soon as it is available. We work with an engineering firm to make sure that we have all of that properly calculated and everything. So we're currently working through that process. And that's what I have for you.
Well, thank you. Now, I'm sure there's questions and comments. Dr. McLanders?
Just a question for
Yeah.
new people moving into the area with young children.
Yes.
What are the methods that we notify their parents that this is ongoing?
Yeah, great question. So we actually do quite a bit of outreach surrounding the event. And the primary one that gets most people is we do a door-to-door mailer that goes to every single address that's located within the Superfund site. And so that is a blanket mailing that everybody gets. In addition to that, we also do advertising on social media, in the local newspaper, and any sort of our online pages through our partners, EPA, DEQ, and our own. We do the advertising of the event.
Do you go to schools? Is that part of it?
We do the school program. We do the school program in May typically, which is right before the summer vacation, so that we can make sure we talk to these children ahead of time. And with the education program that we provide to them, that is mentioned, and we usually do a little brochure with the little gift bags we provide to the students with a reminder that that event is coming up.
Yes, Glenn?
Thank you, Mary. I appreciate the work you're putting in and have put into this. Could we back up one slide?
Sure.
They screened 351 individuals.
Mhm.
Do you know what percentage of the total demographic, 6 months to 6 years, that would be? How many? What percentage of that population have been participating?
That's a great question. And I do always calculate that with the yearly results. So I do not have that now. We try to use the most current population numbers to compare that to. And because we have had an influx of new people moving in, we will be looking at that with all those calculations. So unfortunately, I don't have it with me today.
If you were to make a wild guess, do you
Oof.
dare do that?
I should have looked at last year's a little bit closer, but I want to say it was in the 40 to 60% range, somewhere around there.
Follow-up question.
Mhm.
Do you go to parent-teacher association or anything to give a presentation to the parents to encourage them to participate?
Yes, so we've tried to do presentations through like parent-teacher association stuff. Some of the schools still give us some pushback on that and haven't welcomed us into the schools because there's still a heavy presence of minors that are involved in those plans. And I think honestly, they want to kind of keep it separate. They're a little concerned about us seeming anti-mining, which we are not by any means. So what we have been able to do is get into like the high schools also recently and start doing science presentations for those age groups, which has been really beneficial. So we do the kindergarten through third grade education every year, and now we're starting to do the science classes for the older students too. If we were ever asked and requested to attend, we'd be more than happy to present.
I understand that. Do you know of any homeschooling organizations from that area? Because I know there's a lot of homeschoolers in Bonner County.
Right.
Shoshone County.
Yeah, and surprisingly, with the outreach that we do and like the mailers and everything, we get a large percentage of homeschooled students that do come in. And so when we do see them, we provide educational information at the screening event to make sure that they're getting all the information that is going out to the school attending children too.
Okay, thank you.
Yes.
Do you know what the ages that the AAP recommends these kids have this done? And could you get data from the primary care physicians who are already doing that, primary care practitioners who are already doing that?
Yeah, so they are recommending the 6 months to the 6 years, which is why we're doing that group. And we do have basically a collaboration with the local pediatricians' offices. So anytime they do have an elevated blood lead, they send everything to us if it's coming from the Silver Valley area or if there's a suspected exposure coming from our area. And so then I do a follow-up call with those those parents about that. And if they request an in-home follow-up, then we provide that and do in-home testing.
So it's just a one-time thing between the age of 6 months and 6 years. I just,
Every year you can come in. We do it every single year. So you can bring your child in every year. And even if they're above or outside of that age range, we still perform it for free.
but if you went to your pediatrician's office or your
Mhm.
family practitioner's office, you would probably get it one time during.
Most likely, right. So Idaho actually only requires it with their Medicaid patients. And so that is the Idaho Department of Health and Welfare finally got funding from the CDC this year to establish a childhood lead poisoning prevention program. So this is the first time that we are going to be creating a program to go out and educate physicians and PCPs about testing all children. So that is in the works, and we're really excited about that.
We certainly want you to jump in here, Commissioner. That's your territory. What do you have to say?
It's very interesting. I've grew up through all of it, but it is an asset. I mean, I grew up when there was nothing on the hillsides, and it was an asset. I see a huge improvement in the results. And like she said, we do have still a population that's pretty against it because of the mining industry.
That's a part of it I hadn't even thought about, that there would be people against that for fear it would be taken as we're against mining.
Mm-hmm.
It's a big part of their industry up there.
Sure.
Yeah. And that's been Mr. Chairman, a big part of what the last few years we've really been trying to work with the mines and explain to them that we're here to help you and work with your folks. And they actually did before COVID happened. They let us come up and do some health and safety classes with some of their employees. So I think that we are making progress, and we're seeing a lot of miners now participating in our screening event too. So it's fun.
See, what's so interesting about that is we go right back here to Eric,
Mhm.
and that's his strong position too, that people don't understand when it comes to septic issues. We are here to help you, not to just say no and walk away.
Absolutely.
And that has been a shift in the whole approach of Panhandle Health District on a lot of issues. People have thought of us as the bad guys all many years. And we've tried and to communicate. We're here to help you, not just to be critical of what you're doing. So I really appreciate you bringing that into the picture that I hadn't even thought about.
Yeah.
Any other questions or comments?
I have
Yes.
both maybe Eric, Mary, that with the new mining projects, it's pretty well publicized that it's time to go for gold/silver again.
Yeah.
So what kind of proactive measures, or are we taking any because of the new realization that these mines may open back up again?
Sure. We actually, I can answer that. We are partnering with the Bunker Hill mine that is opening up new exploration, and we've been doing meetings together with Idaho Department of Environmental Quality and then our department, communicating with them to basically make sure that they understand, like I said to Marla, that we're here to help them through the process to make sure they do things right and to support them any way that we can. So it's been great. I work closely with the environmental officers at the Lucky Friday mine, the Galena mine, and the Sunshine mine. So we're all on a first name basis. We attend meetings together. And so we have a very good open communication and are quite familiar with each other's, goals, and we all are working together to make sure that those happen, because that is a huge industry base and it's so important to our valley. So we're actually excited to see more development happen. As long as they do it in the right way, everybody wins. So.
Yes, Glenn?
Thanks, Mr. Chairman. So just a follow up to that question, who monitors the lead levels of the tailings, et cetera, et cetera.
Right. So that is directly through the Idaho Department of Environmental Quality. They have the mining permits that they work with them directly on. And they also do the discharges and any of the, the waters and seeps that are coming out of the mines. So they do all of that monitoring.
Anything else?
That's all I have for you.
Well, we thank you, Mary, for
Thank you.
coming and making your presentation, and Eric for your part in that also. Anything else now? We have both Eric and Mary here. Here's your chance to quiz them. But appreciate what you're doing and the attitude which you display by doing it.
Thank you, Mr. Chairman. All right.
Thank you. Well, Glenn, you're up next. Can you top that?
So that was, no, I'm after the institutional control program letters.
I'm sorry. You go ahead, Eric. I didn't mean to cut you short here. You aren't done yet. I realize that.
No, I know you, Mr. Chairman, you thought you were done with me, but
We're never done.
I will keep this very brief. On tab 3 in front of you, there's a request for this board to support DEQ's efforts to authorize the institutional controls program and place it into statute instead of administrative code. What I have heard from representatives of DEQ that in part is a recommendation of Governor Little. And the benefit of that is that administrative code rules are subject to expiration each year unless they are reauthorized by the legislature. Idaho statute, there has to be an intentional act by the legislature in order to have those removed. Why this is so critical is that the institutional controls program is integrated into the remedy of the Superfund site. So it must continue, and if it's not going to continue, through the health district rule or through DEQ, likely the EPA will interject or have to become involved. And one of the reasons why the health district has been so successful is that there was a lot of distrust of the EPA and even the state of Idaho, in the late 70s and early 80s, whereas the health district has a local board and locally authorizes or implements programs. So they were a much more trusted entity and continued to be so, I believe, which is, again, what helps make this program so successful. So it's my request, and certainly the request of DEQ, that this board authorize the chairman's signature as a letter of support. The one thing that I'd also like to touch on that hasn't been mentioned is we talk a lot about broad community support for this rule, and I do know that there have been letters of support for this action provided from the mayors of the Silver Valley, of chambers of commerce of the Silver Valley, of economic development councils, of mining companies. So this isn't a matter of regulatory agencies standing out and saying, we think this is a good idea. This is truly a community-wide recognition of the value of the continuation of this program.
Okay, you all received a copy of this letter in your packet, and you heard Eric's presentation, and you will notice on your agenda this is an action item. Any further questions for Eric? If not, why we're ready to receive a motion, this letter of support for this institutional control program being put into state statutes.
I so move, Mr. Chairman, that we, as a board of directors, approve this letter of support.
Second motion.
Second, all right. Any other further discussion? You pretty well had that. All in favor then say aye.
Aye.
All right.
Aye.
And opposed, no. All right, we have approved that I put our signature for the health district that goes to the Senate Resource and Environmental Committee, and also the House Environmental, Energy, and Technology Committee. All right, I will sign that at the end of this meeting.
Mr. Chairman, just a question. Would it be helpful if we had other health districts within the state of Idaho also endorse such a letter? Or is that necessary?
I wouldn't have an answer for that right off.
Well, Mr. Chairman, I think that the obvious challenges here is the other health districts are not managing or working with the Superfund site. We are the only ones in the state of Idaho that are participating in something like this.
At the institutional controls program should be in Idaho statute. I would think they would support that kind of move. Are they being impacted by the institutional controls program?
They are not.
Okay. So that answers my question.
Did you have a comment, Dr. McLean? No, okay, thank you. Hey, does that satisfy?
Yeah.
Okay. All right, well, the motion has passed, as you will see in the minutes come next time. All right, Glenn, we're still back to you.
Thank you, Mr. Chairman. This coming next Thursday will be the first executive council meeting under our purview. This year, I am the acting chairman of the executive council, and our director, Don Duffy, is the secretary of that committee, or that council as well. We held a meeting with the vice chairman who represents District 7. And it will be their turn a year from now. Sorry about that. So we got together with Brent Mendenhall. He's from Madison County, and he was pretty well new to the health district and our duties, responsibilities, and what we do as a council. And so I thought it would be a great idea if we reviewed the executive council and the trustees' duties, responsibilities, and the bylaws. So that was a big item on the agenda. We will be reviewing also the Idaho Association of District Boards of Health, the annual meeting, which we will be hosting next year. And we want to get kind of an informal poll as to who would like to be present in person. It's in the past, we've had excellent participation from all of the health districts. They enjoy coming up to North Idaho. We've got beautiful country and scenery, and there's issues and things that they can come up here and see and experience. So we will be promoting that during this executive council meeting. We'll also be discussing the food fees, and then we'll open it up for discussions. So that's pretty much what our upcoming agenda will be. And there was another issue that I was thinking we may want to add to this, but I'll talk about that with Don. So that's pretty much covers what's going to be happening next week for the first executive council meeting. We intend to hold one of these meetings probably on a quarterly basis, and we'll keep you advised of any updates or changes or things that we're considering and that we need to have input from this committee. Thank you, Mr. Chairman.
Okay, thank you. Any
questions?
questions to any of Gwen's comments, report? Yes, Dr. Flanders.
Are there, from the council's view, are there any red flags on the horizon from the legislature this year that we're going to be dealing with?
There's nothing that I'm aware of. But it remains to be seen. We're dealing with the legislature, we're dealing with the governor's office, and they may have issues that we're not aware of, but we need to get up on our radar screen if it does come, so. Mr. Chairman.
Yes, Don.
Mr. Chairman, if I may add to this, and I certainly appreciate Glenn taking over to chair this trustee. So again, every county of the 7 health district, they have one trustee, and those trustees will meet together on a quarterly basis. One thing I wanted to mention about the food fees, your commissioners may hear about this, is the district directors have approached the Idaho Association of Counties to write a resolution supporting what we would like to do with food fees. So next week, IAC meets in Boise, and they have many, many resolutions to consider. They will only pull out 7 to 8 of those to actually support. So I will actually be at that meeting next week. We hope that they do approve what we're asking for regarding food fees. So I just wanted to make you aware of that. Dr. McClandress spoke about the legislature. I just would remind all of you that of the 100 or so legislators, 43 will be new this year. The entire Senate leadership will be new this coming legislative session. So to say it will be interesting is a significant understatement going into this legislative session. Thank you.
Okay. Okay, we're ready to hear from Christine with her report that she faithfully gives to us every time we meet. Christine, you have the floor.
Thank you, Mr. Chairman. As we've done before, we'll start with our ending cash balance. We're reporting for the 2 months ending August 31st. Just as a reminder, our fiscal year is from July 1 through June 30th. So the ending cash balance as of the end of August was $4,759,000. That is an increase of $824,194 compared to what was reported in your board report as a decrease. It is indeed an increase of $824,000 over the June ending balance of $3,935,000. Before we take into account board restricted funds and program restricted funds, we have 5.13 months in reserves. Once we decrease for actually board committed, not reserved, board committed funds of $520,000, $521,000, and program restricted funds of $879,000, that leaves us 3.62 months in reserves. Our program restricted funds have increased considerably over prior months, and that is due to the opioid funds that we have received. In total, to date, as of the end of August, we've received $175,000 in opioid settlement funds. $114,000 of that was PhD's funding. $41,000 was received from the city of Coeur d'Alene, and $19,000 was received from Shoshone County. So again, to date, we've received $175,000. The other item that makes up the increase in the program restricted funds is tobacco funds that were appropriated through last year's legislation to the health districts. So we received $164,000 in smoking cessation funding and $70,000 for youth smoking and vaping prevention. So again, those are included in our restricted fund balance. Are there any questions here before we move on to the budget to actual? No questions, then we will look at our budget to actual here. I did. Oops, that one. Nucia, I'm sorry. Oh, there it is. Thank you. Okay. I got it. I'm driving. Thank you. But that's not the right one. Where? There it is. I'm sorry. You know, I do find when I'm alone by myself in my office, but then back to the top. To the yellow. Thank you. But then I have to admit my nerves get the best of me. Why do I keep doing that? Share here. Okay, I'm not going to do that. I want to get rid of the header of the banner. And I usually do that. Let's If there are no objections, can everyone see the lower portion here? And I can scroll through. Does that work for everyone? Oh, Robert can. Click the full screen. Click the down arrow, the down caret again. Click full screen mode. There we go. Thank you. Success. All right. So again, we're reporting for the 2 months ended August 31st. And what I'd like to remind everyone of is we're cash basis, not accrual. So we're recognizing our revenue when it's received and our expenses when it's paid. So true cash basis, with the exception that we do accrue the accounts receivable for our grants funding. And the other thing that we need to keep in mind is that this budget column here, this year-to-date budget, is only representing 2/12 of the total budget. So the reason why I point that out is some of the variances that we'll be discussing in the revenue section seem distorted, and they are distorted right now because we're only reporting on 2 months. So total fees and contracts, we are over budget by $319,700. And the majority of that is the opioid and the tobacco cessation funding that we just discussed. Our fees are under budget by $112,000. Environmental is currently over budget by $27,000. Home health under budget by $76,000. And health services or clinical services is under budget by $58,500. So the reason why I specifically stated that we're only reporting 2/12 of the budget, comparing it to the actual revenue, as our months go by, that variance should flatten out. For example, when we have the flu clinics, then we will see clinical revenue increase. So in total, our revenue is $511,000 over budget. Salary and wages, employee benefits, total personnel expenditures, we are under budget by $61,000. Operating expense, under budget by $134,600. Capital expense, under budget by $17,600. And trustee benefits, we are over budget by $2,400. Overall, we are under budget by $723,000. So if we look at actual dollars, we have an excess for the 2 months of $823,000. Once we adjust for the accounts receivable, a decrease of $1,000. Adjust for our beginning year cash balance, it brings us back to our ending cash balance of $4.7 million as of August 31st. Are there any questions? No. Mr. Chairman?
Comments, questions? Are you happy with the way this beginning is starting off?
I'm happy with our current months in reserves after board committed funds and program restricted funds, yes.
Thank you for your good job.
Thank you, Mr. Chairman.
All right. We will move on to our director's report. The other day at our school board meeting, I don't know how this is going to come out, but I'm going to say it. At our school board meeting, when the superintendent was called to give his report, someone accused him of being paid by the word. Okay, with that, you have the floor.
Well, with that, we should just move on in our agenda, Mr. Chairman. So a couple of things. I do have a number of things I'd like to review with our board today, and feel free to interrupt me anytime as I move through these important topics. As all of you know, we made the very, very difficult decision to close our home health division at Panhandle Health District, a service that we had provided for nearly 55 years in this area. I might add, we were the only health district providing home health services. In fact, it's very unusual for any health district in the country to provide it. Why we did it was simple. We have had as you can well imagine, a very, very difficult time hiring technical staff, particularly nurses. Right now, I was listening recently to a talk by John Ness of Kootenai Health, where nursing salaries have gone up 213%. If we were to try to hire the 5 or 6 additional nurses really that we need to have that program be financially viable, we would need to be paying them somewhere between $40 to $50 an hour, which simply does not make the program viable for us any longer. So we made that decision. The home health agency will officially close tomorrow. With that said, our staff have done an excellent job. I might just add, of the patients that we still had under care, just for your knowledge, 7 of those were in Benewah, 13 in Bonner County, 4 in Boundary County, 14 in Kootenai County, and 8 in Shoshone County. I am happy to say that all of those patients have been transitioned to other home health agencies, which brings up another reason why it was a little easier for us to make this decision, is there are other home health agencies in the area that can provide that service and provide it well. So all of those patients have been transitioned to other home health agencies. And I'm also happy to say that the 10 employees that will be laid off as of tomorrow, all of them have found other positions and are transitioning nicely into new areas of employment. So I just wanted to update you on that change and see if there were any questions before I move on.
Okay.
I could just
Well, there's-
maybe add perspective if I could. For me, it's a big disappointment in the primary care field. We've been counting on the health district to take care of patients who live in the outback and complex patients. So our home health care agency has really served a need. And all of us were very disappointed that we had to do that. On the broader picture, predicted years ago, 15 years ago, that healthcare manpower shortage was going to happen, and now it is. All the major institutions are in the red. Providence, as you may know, all the giant hospitals on the west side, and Missoula. Providence owns Cadillac, which is in the Tri-Cities. They're right now running at $420 million in the red. Multicare the same, which is Tacoma-based and in Deaconess, as you know, in Spokane. And it's all about manpower shortage, and then paying traveling nurses and traveling physicians a very much higher wage, and it's costing Kootenai Health, particularly locally, millions of dollars. So it isn't just a health district, it's a big deal. I did talk with the University of Idaho president yesterday about this. All the universities are trying to ramp up their training for healthcare professionals. They could be lab techs, they could be medical assistants, you name the name, and everybody's trying to do this, but there's going to be a delay, and it's going to affect, it'll affect Bonner General, it'll affect certainly Shoshone, St. Mary's down in, it's going to be, everybody's being hit by this, so we need to hold on to our hats. Yeah.
Well, my comment is, a few years ago, I don't know what we would have done. I mean Beverly and I, without Panhandle Health, Home Health, I don't know what we'd have done. I understand why the decision has to be made, but it's going to be tough on a lot of people who live in the outlying areas, but are going to run up against questions for which they don't immediately have answers. Don't take this as a negative comment, please. I'm just saying the reality is the reality.
Yes, Mr. Chairman, and that reason is why we kept running home health for such a long period of time. I would just remind all of us, you have to have the staff to perform the service, and we just could not find the staff. And I will say, of the patients that we had on our panel, many of them lived in very remote areas and were absorbed by other home health agency, which was a very big surprise to me. We were very concerned about that. We don't have any of those patients that needed to then move to an assisted living facility or long-term care facility because we weren't involved. None of those patients had to get be admitted to a hospital because we were no longer involved. They did find care with other home health agencies. Now, will that continue for our remote patients? Time will tell. Okay, thank you for that. One just item, I've just, every November, we do a legislative update where we invite all of our elected officials to come to our Board of Health meeting to just give them a summary of what's happening at Panhandle Health District. This is a very interesting year because most of our elected officials in this area will not be in office come the first of the year. There's just so many new positions, and that general election does not take place until November 11th, and our meeting is November 17th. We would be overjoyed if the new elected officials were to come to that meeting and have an opportunity to answer their questions and speak more about Panhandle Health District. So I guess I want to make sure you're all comfortable with still holding our legislative update on November the 17th. And as soon as we know who wins elections, we will reach out to them immediately and invite them to attend for that meeting. We run the risk of not very many people showing up, but I think we still need to offer that, is my opinion, Mr. Chairman.
I would expand that just one little bit. It wouldn't bother me a bit to have someone, a lot of these people come. I'd like to see an increased number rather than a decreased number come to this. But I do think we need to hold it. If only one person comes, we still need to go on record as having offered this opportunity for elected officials to understand the operation of the health district.
So just a question, that's our board meeting day, and the session's going to be in the late morning?
Yes, usually we gather around 11 o'clock for this legislative update. We do the update, invite them to stay for lunch, and then the board meeting immediately follows.
And that's here
Yes, sir.
in this conference room?
We usually hold the legislative downstairs in what we call our show bedroom. It's much larger. And then we hold that meeting, we have lunch down there, and then the board will come up to this meeting for our Board of Health meeting in the afternoon.
And is the public invited? And will there be promotion of it?
The public, I'd have to go back to see if they've been invited to the legislative update. They're always invited to attend our Board of Health meeting, so I would have to check on that, Mr. Chairman.
I don't remember ever the public being invited to that.
It's geared, for whatever it's worth, it's geared mainly for elected officials. Not that we're keeping secrets from anybody else.
It will be an open public meeting.
But yes, but it's still geared to these elected officials.
Mhm.
And I don't know whether that helps you out with your question or not.
The advantage this year is we don't have the COVID limitations on capacity numbers that can be present.
Good point.
That's correct.
Okay?
All right.
Proceed.
Thank you. And just to update you, we talked a lot about the status of our administrative rules here in the health district. And I'm just so pleased that these are being resolved one by one. Eric talked briefly about DEQ, dealing with the ICP work in Shoshone County. The other is our 5-acre rule in the Prairie Rathdrum Aquifer. And we're very pleased. Eric and I both attended the Kootenai County Commissioners meeting here last week, and they adopted the 5-acre rule as part. It's now a ordinance in Kootenai County, the 5-acre rule. So we were very happy. What was interesting about that, there was a number of people that came for public comment, all supporting Kootenai County's rule, but really asking the question of, is the aquifer properly mapped? You know, maybe where I live, the aquifer should also, we think we sit above the aquifer. So that brought us some questions, including from the commissioners. Again, the last time the aquifer was measured or estimated was back in the 70s. And so just letting you know about that, there is a group wondering if they are not under the aquifer or possibly just under a recharge area for the aquifer. So more to come. But ultimately, we're very, very happy that that rule is now is an ordinance associated with Kootenai County.
Okay, Dr. Fletcher, go
Yes,
ahead.
for those who are ignorant, what is the 5-acre rule?
The 5-acre rule is that you can only have one septic tank on 5 acres. So that's essentially what the rule is, and Eric could certainly add more light to that. Now, if you have a sewer system, obviously it doesn't nullify the rule, but it'll obviously move the affluent out of that area. But it's essentially one septic tank per 5 acres if you live over the aquifer.
If you live over the aquifer.
Yes.
Eric, do you have any comment that would help out in his question?
No, Mr. Chairman, I believe that Don did an adequate explanation of that. And yeah, frankly, it's a very simplistic way of minimizing contamination to the aquifer because it's just sands and gravels from the surface straight down to the water table. So it was seen as a measure of protecting that by limiting the amount of wastewater that could impact the water quality.
Yeah, that's intuitive. So you indicated that the last time the aquifer was measured was in the 70s?
Correct.
So the population has changed in the last 60 years, 50 years. Is there a plan to measure it again?
Well, again, measure is what I'm referring to, Mr. Chairman, is where is the aquifer?
Yeah.
That's what we're talking about.
Not its content.
Yeah, well, and I will say in the 100 years that the aquifer's been measured, that it has not lost any, there's been no degradation in the quality of water or even the volume, even though 500,000 people, that is their primary water source.
Wow, that's impressive.
Yes, sir, it is.
Sand and gravel is a pretty good filter.
But part of the problem is Eric hasn't come up with a way yet to clean the aquifer should it ever become contaminated.
Mr. Chairman, I don't know if anyone has the answer.
Oh,
So another 30 seconds on it. This Board of Trustees was sued by the Idaho Department of Environmental Quality when that 5-acre rule was adopted.
Really?
Yes. And then the rule prevailed based upon the information and research available. Documented sole source were now 600,000. Then it was about 300,000 people, all of Spokane. So the board had individual and as a body was sued by DEQ. So that's history.
see, to tie onto that, I'm sorry here, but I have been concerned, see, talk about 500,000 people, there's 500,000 people feed off this aquifer on the Washington side. And I've often thought that some of those county commissioners over there in Spokane County should be concerned about this issue too, but they don't seem to care a hoot about it.
There is a working group, the Spokane Rathrum Prairie Aquifer. It's an active group, and I do think Spokane County commissioners are still part of that group, right?
I hope so.
Yeah.
But over the years, it's just been, well, that's Idaho's problem. But it isn't just Idaho's problem. I'm sorry.
They're downstream of Idaho.
Yes.
Well, I commend the actions of the board. I mean, you have to be appropriate stewards of your water resources. And just parenthetically, so I come from Texas, and there's a large aquifer in the central part of that state called the Edwards Aquifer. And just to know, they have been monitoring the capacity of that aquifer. I don't know about water quality, probably also quality, but at least capacity. and it is 10% of what it was 50 years ago. 10%. It is 90% depleted, and there is no trend towards recharge. So it is possible for a group of people to overexploit their subterranean water resources. Just FYI.
Yeah, we know.
Well,
Yeah.
and see, no, I don't know whether anybody mentioned this, but there have been times when some of this idea of the 5-acre rule hasn't met with certain builder associations and contractor associations with favor. It's been an uphill battle with some of those people because they see 5 acres as room for 10 houses. And 10 septic tanks. Enough said.
Well, Mr. Chairman, there's never enough said about this, what I keep calling the unseen jewel of North Idaho, and that is our aquifer. And I will add just one more comment, and Eric, please correct me, but it is of an aquifer of this site to know that we can drink directly from that aquifer without it being filtered is very unusual. I suspect in Texas that whatever is left in that is being filtered at this time, so.
Mr. Chairman, if I may add, if you look at a map of the state of Idaho aquifers, we are one of very few, if not the only aquifer that is not considered a nitrate priority area in the state due to contamination.
Wow. So it is a precious resource.
Glenn, you had your hand up a moment. Did you get your question taken?
No, it was the same comment. I was just curious if the 5-acre rule had changed or been modified. It's just the same as it has been.
Mr. Chairman, they mirrored our original
Okay.
administrative rule on the topic, yes.
Thanks for the clarification.
Okay, Mr. Chairman, moving on. I wanted to talk a little bit more about these opioid settlement funds. Christine alluded to this in her financial presentation. And just to update you, this is a very interesting topic. The monies that will be flowing into Panhandle Health District are, I would say, significant. There is a number of opioid producers that are part of this settlement. J&J, McKesson, Cardinal Health, Janssen are all part of this settlement. This year, and we talked a little bit about allocations. Bonner County, Shoshone County, the city of Coeur d'Alene, and Hayden all received opioid settlement funds and all have allocated their funds to Panhandle Health District. I might say this is very unusual in other districts. They did not see this allocation happening to the health district. And the reason that we are seeing it is the work Kim and her group has done over the last 5 years in opioid use disorder motivated these municipalities to allocate their resources to us because of the great work that we're doing. Kootenai County is currently considering that. They have not made the decision to allocate. But with the monies that PhD is receiving and with the allocations, by the end of the year, if our calculations, I believe they're correct, we will receive over $1 million in opioid settlement funds. And then, and part of that is because Janssen, they wanted to pay us 4 years in advance, so it kind of skews the numbers. But I think I can safely say, if that did not happen, and if the allocations remain the same, Panhandle Health District will be receiving almost $440,000 a year for the next 16 years on these opioid settlement funds. So we take that very, very seriously and how we're using those programs. So Kim and her team, we are reaching out to all of the counties. We're talking healthcare providers, FQHCs, schools, law enforcement, other first responders, to ask them how they see how they might see fit that these funds are being used. We might be in a position where we are subgranting these funds, if you will, to tackle this serious problem that we have here in North Idaho. So we hope to, by the end of this year, have a clear plan to all of you on how we're using these funds to tackle opioid use disorder and substance use disorder going forward. But I invite any of you, if you see a use of these funds, please speak with us. There are clear deliverables on how these should be used, but it's pretty broad, I might say. So we look forward to meeting closely with our partners on how these funds could best be used. So there certainly will be a lot more to come on this going forward. So we'll be reporting to you on that. Finally, just one more item. Last weekend, we had last Saturday? We had our maybe a week ago Saturday, we had our suicide prevention walk at Riverstone Park. We had over 425 people that attended that walk. And, I will say, as district director of all the programs that I've been involved in, that one I enjoy the most, being with so many people that have lost loved ones to suicide. We're happy to say that we had our Councilman Amy Evans from the city of Coeur d'Alene joined us to read a proclamation. And we also had Governor Little was at our walk here in Coeur d'Alene on that Saturday as well. And it was a marvelous event, wonderful people. And I might say of those that registered, over 70% had lost a loved one to suicide. I was walking through the audience and working with the walkers and working with people. Jill Ainsworth was our chairman, but I was over volunteers. So I had the opportunity to meet a lot of people. And I hear my name. It said, Mr. Duffy. And I found a friend of mine. He had played football with my son on the 2012 Coeur d'Alene High School state championship team. And I said, Thomas, what brings you here? And just a week earlier, his twin sister had completed suicide. And Thomas was there with his lovely wife. And I said, what brought you here? And I said, I just need the support of this event. So again, just one of those things we don't hear about that happens within the health district, in which that we're serving our community in a very, very significant way. And Mr. Chairman, that's the end of my report.
If I could make one or two comments about a summary for this entire meeting today, is this idea that we're not here, our people are not here just for the fun of it. Our people are here serving a need, a great need in our communities. And we probably often go overlooked, but I want you to know how much I appreciate all of our folks, our employees, whether it's cleaning up the lead up in Silver Valley, whether it's lending an ear and a heart to those who have had a loved one in the suicide column. This health district is needed, and you are such a wonderful part of that need in our 5 counties, and I want to thank all of you. And if there's no more business to come before this board at this time, thank you for being here, and we are adjourned.
Thank you, Chairman.
Thank you.